Congressman Bob Good has been to the southern border 4 times. He had a chance to see firsthand who's coming in, how they make their way into the country, and what this means for national security. I spoke with the congressman earlier. Congressman Bob Good, thank you for joining us on the Capitol Report.
Great to be with you, Steve. Thanks for having me again.
Absolutely. Congressman, you were just on the House floor where you were speaking about the border crisis. You said that the current administration's policies are welcoming illegal immigration. What did you mean by that?
All of the resources this administration is committing to the border is intended to facilitate an increased invasion at our southern border. They're doing nothing to prevent the crossings. They are doing everything they can to increase it, to facilitate it, to enhance it, trying to hide it from the American people as quickly as they can. The only concern they seem to have is the PR disaster of the American people seeing what's happening at the border. So all their efforts are to try to process as quickly as they can as many illegals as they can while they have power.
Congressman, you mentioned that there's potentially, I think, over 40 people on the FBI's terror watch list that have been apprehended on this. So that's really unfathomable. Can you tell us about that?
Yes, with the 2.4 million illegal crossings that were encountered by our Border Patrol, and frankly, most of those released into the country, 42 of those had known terrorist ties. And the point that I was making was, what about the 700,000 criminal gotaways, those who are evading apprehension, evading capture? Think about how generous our policies are. Where we take you into our custody, we fly or bus you wherever you want to go, we give you your free phone, we give you free social services, free health care, free education, and we take you in, connect you to an NGO to take care of you. Most are surrendering into our custody. Who are those that don't want to surrender? The ones who are evading capture. They're the ones, I've seen it when I've been on the border 4 times, they're wearing the carpet shoes, they're dressed in camo head to toe because they have criminal ties, they have terrorist ties, they're trafficking drugs, they're trafficking children, human trafficking, sex trafficking, you name it. But how many with terrorist ties among the 700,000 that we didn't apprehend? No one knows. And it's really incredible. This week, this Homeland Security Director acknowledged he doesn't even know where the 42 are. He couldn't even tell us where the 42 are that they know had terrorist ties that were among the 2.4 million apprehensions.
I mean, I think a lot of times when people think of the problem on the southern border, they think of Mexico, maybe some South American countries. But do you think that these policies are kind of triggering people in some of these known countries that have, that are terrorist hotbeds to make their way here because they see it as a good opportunity?
They're coming from 160 different countries. I just came from a border caucus hearing where we had the new Border Patrol chief, Chief Magnus, and we asked him about, hey, because everything that he talks about or Mayorkas talks about or Vice President Harris talks about is trying to deal with the root causes in other countries. And I asked him, can America fix everything among the other 200 or so countries of the world, the 7 billion people who don't live in this country, and fix things there so that people don't want to come to America? Is that even possible to do? Setting aside whether or not it's our responsibility or we should commit resources to doing that, but take their stated policy to the conclusion, how could we ever effectively do what they say their priority is?
Congressman, this truly sounds like a national security issue. Is the intel community briefing Congress or the White House on this?
Well, we do get superficial briefings, if you will, but we don't get answers to the most basic questions. When you just watched what the oversight was doing with Mayorkas this week and judiciary oversight hearings, they're getting questions of, oh, I'll get back to you on that. They seem to always have the information to make the point they want to make, but when you ask for tough questions with tough answers they don't want to give, they never seem to have the data.
Terrorism, drugs are obviously hot-button issues that, highlight the crisis on the border. What do you think the long-term impacts on our country when tens of thousands of economic migrants make their way in here gradually?
Untold damage has already been done. I said this this morning in that hearing, this budget hearing that we had with this committee hearing we had with the chief of the Border Patrol. Said, hey, we've allowed some 3 million to come into this country in the first 15 months or so of this administration. If we secured the border now, only the weeks, months, and years ahead will tell the untold harm that's been done, the irreparable harm that's been done in our country. Again, not only with the economic harm and the healthcare harm and the education and social systems harm that we're trying to bear the brunt of all these illegals coming into our country, but also, those with the criminal ties, the terrorist ties. It's as if the Mexican crime cartels designed our border policies. They couldn't have designed a better policy if they designed it themselves. We are basically facilitating them to make hundreds of millions of profit every month off the trafficking of thousands and thousands across our border every month.
Congressman Bob Good, thank you.
Thank you, Steve. Great to be with you.
Russian President Vladimir Putin accepted an invitation to attend the G20 summit to be held later this year in Indonesia. But the Pentagon today had this to say about whether Putin should be welcomed at the summit.
No, he absolutely shouldn't be. I mean, he has isolated Russia by his own actions, and he should continue to be isolated by the international community.
The Pentagon spokesman said Friday he couldn't speak for President Biden's schedule or attendance to the G20 summit. Biden said last month that Russia should be removed from the G20. Meanwhile, the Indonesian president has also invited President Zelensky to the November summit. That means leaders of the two warring nations could appear at the same event, setting up a potential clash. Former President Donald Trump posted his first message on his Truth Social account, signaling the former president's return to social media. Trump shared a photo of himself standing in front of his Mar-a-Lago club in Palm Beach. He wrote the words, "I'm back," and Covfefe. The mysterious hashtag Covfefe refers to a word Trump first posted on Twitter in 2017. He never explained what it meant, and it's still open to interpretation. The short post comes as Elon Musk sealed a $44 billion deal to buy Twitter last week. Twitter banned Trump's personal account and his campaign's account while he was still president in 2021. His own app, Truth Social, was launched in the Apple App Store in February and has been at the top of the chart for the most downloaded app, just above Twitter. The Biden administration's Deputy Communications Director, Maria Pili Tobar, announced that she's leaving her position. Tobar's departure is part of a staff turnover that the administration is facing just before the 2022 midterm elections. Tobar says she's returning to work in the private sector and to spend more time with her family. Press Secretary Jen Psaki is also reportedly leaving her post in May for a possible position with MSNBC. The FDA is signaling that they may authorize COVID-19 vaccines for children as young as 6 months old by June. Both Moderna and Pfizer have applied for emergency use authorizations for their vaccines on children from 6 months to 5 years old. The FDA said it plans to convene its advisory panel on vaccines to consider whether to extend these emergency authorizations. A spokesperson for the agency told the Epoch Times that when the FDA consults the advisory panel, it will wait to hear from them first before greenlighting or rejecting applications. With the FDA getting set to approve these vaccinations for young children, and Dr. Fauci stating we're at the end of the pandemic, this might leave some wondering where we are in the overall state of the pandemic. Dr. Peter McCullough is an internist and cardiologist, and we're happy to have him on to discuss. Dr. Peter McCullough, thank you so much for joining us on the Capitol Report.
Thanks for having me.
Doctor, the FDA is indicating that vaccines for children as young as 6 months old could be approved as early as June. How susceptible are these babies to the virus, and are there any studies that you've been monitoring that you think the public should know about?
We've heard reports recently from the CDC that roughly 75% of children have already had COVID. So for them, it's too late for any hope of a vaccine. But the vaccine can't help once somebody's already had COVID. Now, for those who are still susceptible, COVID-19, through its progression of mutations, has become progressively more mild. And now with the Omicron variant, we have outcomes data, ages 5 to 11, that we can extend down to older age groups. And the papers by Dora Bawilla and colleagues from New York State, over a couple 100,000 children, age 5 to 11, virtually no clinical benefit, no vaccine efficacy. All the vaccine efficacy was less than 25% in that study. Remember, if a vaccine doesn't have at least 50% coverage, it's considered non-viable. So I think for children that age, it's a non-starter. The vaccines simply don't have a clinical indication. And even when we've looked at it, it looks like they don't work.
Dr. McCullough, Dr. Fauci recently announced that the pandemic was ending and has since backtracked a bit. What's to make of this on again, off again?
You know, we're very disappointed with the lack of consistent messaging. Remember, the emergency phase of the pandemic, which is the most important part, that's predicated on the risk of hospital overflow. And most municipalities have set 15% as the limit. We're far below that. Many hospitals are empty with no COVID cases. We're through the Omicron outbreak. So far, there appears to be no major pockets of susceptibility left. We have a slight uptick in cases right now, and we'll have to monitor it. But we have not been close to that 15% overrun in a very long time. In fact, we hit that close to that in January of 2021. So it's been more than a year right now. The emergency phase of the pandemic is over with. We can return to normal and then just treat remaining cases that we have left.
To your point there, Doctor, when Omicron first surfaced and was shown to be far less virulent than, say, Delta, you were a cautious voice telling the American people that this could mean we were entering into endemic, the winding down of the pandemic, if you will, which does seem to be the case. Is this a message that we should have been hearing from public health officials at that time?
We should have definitely heard the message that it's milder. There can be a rare senior citizen or someone who gets progressively ill. We should have always messaged to them about the efficacy of virucidal nasal washes with povidone iodine, hydrogen peroxide. Every American should know about that. Nutraceuticals and supplements, where to find monoclonal antibodies when a high-risk patient would need them. And nowadays, we actually have good drugs. We have the Pfizer Paxlovid, of which Vice President Kamala Harris is taking right now, or molnupiravir. But, I can tell you, we have studies now, large studies of Omicron, where there's close to zero hospitalizations or deaths. It's essentially a common cold.
I have to ask you, with the possible potential liberation of Twitter with the takeover by Elon Musk, there was so much suppression from people like yourself and the medical community. What type of censorship, if any, have you or your colleagues experienced?
There was all kinds of acts going on. The most obvious ones would be somebody locked out of their Twitter account for tweeting a summary of a published manuscript. A published manuscript which is available elsewhere on the internet, things like that, which were way over the line. But then there were actually more nefarious activities, such as automatic unfollow programs. Someone who's in a public figure would not develop followers. They would be automatically unfollowed. There were shadow banning operations that were going on, and then assigning of bots and other types of instruments to try to ramp up false narratives surrounding that individual. Hopefully all that's cleaned up. Twitter's nothing more, nothing less than a common carrier. They can have certain rules regarding like Federal Communications Commission, like nudity and explicit language and things like that. But outside of that, they're a common carrier. They have no business blocking a summary of a manuscript, a scientific manuscript, to the public. In fact, that is itself has led to bad outcomes, and I think should be called to justice.
Dr. Peter McCullough, thank you so much. Washington, D.C. and 16 other states sued the Postal Service to halt the purchase of thousands of gas-powered vehicles. State attorneys general and environmental groups in New York and California allege that the agency has not considered the environmental impact of its purchase.
There was a violation of the National Environmental Policy Act, which requires an environmental impact statement before undertaking a massive enterprise like the commitment to buy these vehicles.
The Postal Service is planning to replace over 100,000 aging trucks over the next 10 years. The Biden administration has urged the agency to transition to electric vehicles. Under the Postal Service plan, 10% of new trucks would be electrically powered. Postmaster General Louis DeJoy said that the Postal Service doesn't have the funding to increase the number of electric vehicles.